at the World Bank. Couple of things before I start. One is, as you can see in the screen, there is like an icon that you need to click actually if you want to hear this in English, or if you prefer it to do it in Creole. If you want to do it in Creole, you select the French option. If you have any questions, please click in the Q&A link. And we are going to get all your questions, and then we will answer them at the end of the presentations. Well, today I'm very, very pleased to be the moderator of this, I would say, like great program that has been implemented by the organization Beyond Borders, and the program is Rethinking Power, and is an adaptation of the very well-known intervention for transformation of gender norms and preventing violence against women, SASA. This is the adaptation of SASA in Haiti, and it's a kind of like a SASA plus because it includes other components of SASA with a very important focus on women and girls. So this work has been led by Sarah Siebert. Now is like the implementation of SASA started many years ago, and the adaptation in Haiti probably I think started in 2015. Then they moved to a more very rigorous adaptation, and at the same time, in years ago, we decided that this deserved to have a very rigorous evaluation using mixed methods. At the time I was at the Global Women's Institute, I was lucky to be part of this study with my colleagues who are going to present the results of the impact evaluation. And I think this is a great, of course, I'm a little biased because I was part of it, but in general, I think this as now having the opportunity to review a lot of programs and studies about what works to prevent violence against women. I think this adaptation is of SASA, one, programmatically speaking, is being really great, and and also in terms of knowledge to understand how one of these very well-known interventions can be adapted to other region, to other contexts. In this case, well, Haiti, in a different continent, and using basically the main structure of SASA. So I think for the field of violence against women and girls, this is what our colleagues are going to present is very unique and is very important for our field. And again, I was very lucky to be part of that when I was at the Global Women's Institute. As I mentioned before, the evaluation was coordinated by this institute in partnership with two other institutes in Haiti, IFOS and Pentagon, who support the study. The Global Women's Institute is part of George Washington University, and the institute specializes on doing research on violence against women, women's empowerment, gender equality, but also at the same time, a lot of the research is connected to the to the field. That's the kind of the goal of the type of research of the Global Women's Institute, is always to connect the research with action. And as I mentioned, the collaboration was with two research institutes in Haiti, IFOS and Pentagon, where they were involved in the baseline and midline. And we have the opportunity to do this with the support of Novo Foundation, TIDES currently, and the Inter-American Development Bank. That was the part of the evaluation. Then moving to the implementation of the program, the implementation of the program has been carried out by a very important NGO in Haiti, Beyond Borders, has like a very, very strong presence in Haiti, very well-known NGO that supports movements to end child slavery and guarantee universal access to education and end violence against women and girls, and replace systems that oppress the poor with systems that support dignified work and sustainable livelihoods. So this Rethinking Power program within Beyond Borders has been like a very, very, we are going to see, very effective in the prevention of violence against women and girls. And not just that, Beyond Borders has a function as an organization helping to disseminate and this work in the entire region. The implementation of the program has, as I say, it was SASA, but including other components like women, like the component with adolescents and girls, and the component also of people with disabilities. So it's very, very unique. And this has been also supported financially by Novo, the UN Trust Fund, America Jewish World Services, and Imago del Fund. Now let me introduce you to our speakers of today. First, we are going to present an overview of the program in Haiti. For that, I would like to introduce my friends, colleagues, Emanuela Paul and Daniel Adonis. Emanuela is the coordinator of the Beyond Borders Rethinking Power program. She is a sociologist, an anthropologist, and a feminist activist and gender activist. She has experience in national and international organizations and in program evaluation. Her interests include human rights, culture, education, and development. Welcome, Emanuela. And Adonis is a local activism officer in the Rethinking Power program since 2014, before which he was part of the SASA Activist Network as a journalist. He's a theologian. Sorry, that is not a very common word for me to say, but he's a theologian who also studies judicial sciences. He has a long history of child rights work. He's also a father and a husband who believes deeply in the balanced power between women and men, and he always teaches that to his children. So welcome, both of you. Welcome, Emanuela and Adonis. The floor is yours. Please start, and they are going to switch to Creole. The ones who people who are in English, you stay in the same channel. So please go ahead. Thank you. Merci.
Can we have the next slide, please, also?
Yes. Thank you.
Bonjour, Manuel.
Good day, Manuel, and everyone who's with us today. Very happy to be here today. As I said, my name is Emanuela. I'm living in Haiti, in Jacmel, in the Southeast Department, where Beyond Borders is directly implementing the SASA program, and I'm happy to be with here today. I should say that Beyond Borders is working in Haiti since 1993. It has several programs. It's working in urban areas and in rural areas to support model communities. And it's also working on the island of La Gonave. And with the Rethinking Power program, we are working specifically on prevention of violence against women and girls in the Southeast. But at the same time, Beyond Borders is present throughout Haiti because we have a technical assistance program. The Rethinking Power has a technical support program where we're supporting a number of women's organizations throughout Haiti to use the methodologies that are evidence-based in order to prevent violence against women and girls in their communities. We have 6 or 7 technical support partners in the north of the country, like AFASTA. We are working in the Western Department with EDEH and others. We are working also in the South, in the NIP department, and in the Central Department with MPP. And so we have several partners implementing either SASA or Power to Girls to prevent violence against women and girls. And through that part of our programming, Beyond Borders is present in working on prevention of violence and girls throughout the country, in addition to doing direct implementation in the Southeast. So to do this work to prevent violence against women and girls, what do? We use 2 methodologies and a resource pack, a toolkit that goes alongside them. The primary methodology, as you may know, is SASA, which is a methodology that was developed in Uganda and was created in 2008 by Raising Voices in Uganda. And in Haiti, since 2010 to 2015, we adapted that methodology to the Haitian cultural milieu. We translated it into the Creole language. So we have SASA completely translated into Creole. We're working in communities to use a community mobilization approach that is the backbone of SASA in order to enable community members and to work in all of their circles of influence, from the individual level to the institutional level to the organized group level, to engage in activism and mobilization to change social norms and to rather have them support balanced power between men and women in couples and in society. And through that adaptation in 2010 to 2015, the program at the same time was being implementing the SASA in 4 zones in the Southeast, in Jacmel, Kai Jacmel, and in Cap Rouge, and in one other. We were through that implementation process, using a community mobilization process where the community members were directly involved in adapting this in the translation process and in the entire process of social norms change that is a part of SASA. We saw that it was important to do more work on girls, because while we were using SASA, we saw that it was effective in reducing intimate partner violence in communities, but it was not automatically translating into prevention of violence against girls. The 4 stages of change within SASA were not automatically delivering in balancing of power between girls and boys in the same way that it was doing so between men and women. And therefore, in this sense, the community asked us to focus more on how we could reduce violence against girls. And so therefore, using SASA and the kind of methodologies that SASA embeds, we developed something called can we advance the slide? We developed Power to Girls. So what is Power to Girls? Power to Girls is the same as SASA. Oh, it is activists, groups of activists that are engaged in working against violence against girls in their communities. Through that methodology, there are several points of focus on girls' empowerment and girls' rights, and in spaces where girls are present. For example, we create safe spaces for girls, girls' clubs, which are spaces particularly for girls, where girls can learn and create relationships, supportive relationships together, and go through their own experiences as dialogue spaces and learning spaces around specific themes like power, violence against women, violence against girls, and other themes. The audio is breaking up. And so I've lost it now. Just see if it comes back in. I'm sorry, but I've lost the audio. Okay, it's come back.
Okay.
I've asked her to go back to the girls' club. So we have girls' clubs, which are specific element of the methodology involved in the methodology. So these are spaces specifically designed for girls, where they are able to discuss specific themes, leadership, friendship, relationships. They can dialogue together and build their relationships and understand the power that they have to create change. But it's also a space that is developed to enable girls to develop their own capacity, because we know when we're talking about pouvoir, that's about power, that's building capacity. So there are seminars that are delivered in for the girls on different activities that are either manual in nature or intellectual. And this clubs allow the girls to be participants and owners of that space. Another specific element of the methodology for Power to Girls is community mobilization around girls' empowerment. So the entire community using different communication materials, such as posters and others, communication materials for chats with parents and others. These are used to mobilize people within the community to enable them to develop, increase their understanding, and to participate in balancing power between girls and boys, to enable girls to assume their rightful power and leadership within the community. The other specificity that we have is working in schools. Within this methodology, there's a focus on working in schools to work in schools to reach out to boys, so that boys can also participate in this norm shift within the community in their own behavior change. And they participate in the process of understanding the importance of girls' power in the community and ensuring that they support that. We work through other organizations and partner organizations so that they can participate in what we call Power to Girls, supporting girls' power in the community. So that, as I said, Power to Girls is based on the same community mobilization process as SASA, but with a focus on girls in all of their aspects and all of their activities in the community, in the broader community, or in specific spaces for girls. Can we advance this slide? Thank you. At the same time, as we were developing these methodologies, bringing them together, we had the opportunity thanks to funding from the UN Trust Fund and with the collaboration of two partners, local partners, SASA in the Southeast Department, which is an organization that is working specifically with people with disabilities and that has experience in disabilities and in accompanying those with disabilities in the Southeast. And also we worked with Production Teatro Patu, which is a cultural and theatrical group that is working specifically with women and girls with disabilities. So we joined our expertise with theirs, our experience in materials creation and in prevention of violence against girls, women and girls. And so together, the three organizations came together with UN Trust Fund financing to create a toolkit, supplementary materials called Safe and Capable. What is that? The resource pack is not a standalone toolkit. In order to use it, you must be doing SASA or Power to Girls because they have the complete community mobilization methodology. But this resource pack comes in and it follows the same phases of the community mobilization, but directs focus to women and girls with disabilities. So this resource pack, this is a toolkit that is there to enable activists or people in the network to mobilize in their communities to prevent violence against women and girls with disabilities. So it's an intersectional approach directed at that. And through this resource pack, it allows community-wide prevention and mobilization for mobilization around the rights and well-being of girls and women living with disabilities. So these three methodologies came together in our implementation period over the period, the last cycle of implementation in La Vallée. And so now we will see the results of using those three methodologies. I'm going to turn it over to my colleague to talk about all of the work that we did, all of the mobilization work that we did in the community. Could we have the next slide? I would like to say good day to everyone. My name is Danielle Adonis, as was mentioned in the beginning. I'd like to thank Emanuela for her presentation of the methodology and the program. And I could also add that we worked with those two main methodologies and the resource pack that looked at working with girls clubs, and in the communities we had community leaders and other groups that we were mobilizing in the community in a community network that worked together with Power to Girls, SASA, and on a number of activities. So to do all of this work that Emanuela described from January 2017 to June of 2021, we mobilized 575 community members who were trained in the 4 phases of the SASA and Power to Girls methodology in order to work on violence, preventing violence against women and girls, including those living with disabilities. And we saw many changes in the lives of these individuals. And with these 575 members of the community network, we were able to do more than 15,000 community mobilization material activities that allowed us to reach over 20,000 people in the community. These activities we had several groups of activities. For example, in the community groups that we did door-to-door working, community engagement, theater, radio interventions, activities in churches or in the community, activities also that were done in schools. And through these activities, we were able to create significant impact in communities and to change people's lives and experiences. For example, there were 2 schools that were trained, and they were in mobilizing people around prevention against violence against girls. And they created codes of conduct that were applied in the schools. And the belief of children, the beliefs, attitudes around change, around the roles, gender roles were changed also in the community, and intimate partner violence was reduced. So we also have 3 advocacy committees that grew out of this work, and they are working in both institutions and the public to advocate for institutional changes. And they've grown out of 2 of them have grown out of girls clubs, and 1 are formed through adults, and they are working together to create organizations to advocate for reduction in violence and for rights of women and girls in the community in La Vallée. We're looking to see if we can get communal or district level decrees that come out to support the prevention of violence against women and girls, and to prevent intimate partner violence. So through that mobilization that was done in the communities during from 2017 to 2021, we had quite a lot of difficulties to overcome. That was part of that was the COVID-19 period. So we had to slow down a little bit, in terms, had to do distancing. People were more staying at home, and it was more difficult to do community activities. And then we also had difficulty where there were armed gangs that came from Port-au-Prince and that were in one of the communal sections where we were working. And so we had to sort of fall back a little bit. And there was quite a lot of political instability, a lot of barricades, and this made it more difficult for us to mobilize from one place to another. But the fact that we have activists in communities helped overcome that. So we had slight slowing down of our activities. For example, people from one section could not go to the other. And it was more difficult for girls to come to clubs, and certain schools, the schools had to close for a period of time, and that had an impact. However, that didn't stop the work completely. Okay, lost the audio for a second here. Still no audio. Let's see if they snap back in. Because they'll either drop or pick up. Let's see, let me pop in.
Yeah, donc, nous te dit, malgré défis ça yo, eh ben,
In spite of these challenges, with the engagement of people in the community network, we were able to overcome these challenges, and we continue with the implementation through 4 years in La Vallée, and which gave us all of the results that we'll see. Thank you very much. Next slide.
Thank you so much, Emanuela and Adonis. Clearly, you can see to the audience this is a great program. I had the opportunity to be there, to interact with the team, and it's really impressive the work that you do, especially with all the challenges that have been already mentioned. It's very, very inspiring work. Now that I'm seeing the pictures, a lot of memories coming, and I miss you guys. My heart is with you. It's really great to see that how you have overcome all of these challenges, and you continue really making a change for the life of women and girls in Haiti. Thank you so much. I thank you for me, and I guess speaking for the whole humanity. Thank you. Now we are moving to the research piece with my ex-colleagues and current friends, still friends, of course, Maureen and Angela. Maureen Murphy, who is a research scientist with the Global Women's Institute at the George Washington University. Maureen is a doctor of public health candidate and has a professional interest in improving M&E in complex emergencies, particularly in the realm of gender-based violence and reproductive health programming. And also Angela Boraza. Angela is a research associate with the Global Women's Institute and a PhD student in social and behavioral sciences in public health, and has a professional interest in community-centered research for prevention of violence against women and girls in development and low-resource settings. Please, Maureen and Angela, and they are going to talk about the study and the results. Thank you.
Thank you so much, Manuel and Emanuela and Adonis. It's so lovely to hear from the ground in Haiti. I think when we think about research, sometimes we forget about thinking about the program. So I'm really happy that we got to spend a little time hearing about the program that you guys were able to implement over these last few years. As Manuel noted, I'm going to start off our presentation about some of the initial results that we're getting from our impact evaluation of the Rethinking Power program in Haiti. I'm going to be talking about some of our general results, and then I'm going to hand over to my colleague, Angela, to talk about some more specifics. Next slide, please. So first about the study. So we used a quasi-experimental evaluation approach, which basically just means that we did not randomize any of our communities. And we did that really for practical and logistic reasons. As we know, approaches like SASA are community mobilization driven. They require people talking to one another and people being able to speak to each other, to change norms, to change behaviors, and to do that in a way where we were to allow randomization was just going to not really work for the study, given the rural nature of Haiti. So to compensate for that, we picked the intervention site of La Vallée, which is the blue on the map here. And then we looked for a similar area, which we picked Marigot, which is the purple on the map here, which is similarly sized, a similar distance from the main city Jacmel in the area, and has a similar sort of socio-demographic and economic profile. For the actual study itself, we focused specifically on the experiences of women and girls aged 15 to 64. But then we also had a specific sub-focus on adolescent girls as part of the Power to Girls program. And of course, women and girls with disabilities and their experience with a safe and capable toolkit. We used a mixed methods approach with quantitative data through household surveys, as well as qualitative information to supplement this. We collected data in 3 rounds, first at baseline in 2017, then a midterm in 2019, and then finally the endline in 2021. I will note that the women and girls with disabilities section was specifically added during the midterm in 2019, so we only have data on that for the second half of the study. Next slide. As Adonis so well put, the context was very complex, both for the actual implementation of the program, as well as, of course, for the evaluation. These contextual challenges that he spoke of, the social and political unrest, insecurity in particular in La Vallée, the intervention communities, as well as the outbreak of COVID-19 certainly affected the study. When we look at just some of the numbers in La Vallée in the intervention areas, 6 in 10 women and girls said their community had been affected by insecurity. 1/3 of women and girls in La Vallée reported a serious problem with food, and 2/3 of these said that that problem had worsened in the past year. And about half reported that their mobility was restricted. So we can see that the contextual factors had a real impact on women and girls, particularly in the intervention area. And of course, this was a little bit of a concern for us as evaluators, and of course for the Beyond Borders team as they were thinking about what the results were going to be of this study, because we know a lot of these factors are actually risk factors for violence against women and girls. So they might be actually increasing rates of violence while the program is seeking to decrease it. So what did we learn? Next slide. So just again to show, insecurity really was affecting, in particular, the lives of women and girls in La Vallée, and actually increasing actual experiences of violence. Next slide. So what we, excuse me, what we found was generally really positive results. I think we were really excited to see that despite all of the contextual problems that affected not only program implementation, but also could potentially increase rates of violence, despite all that, we actually really found that the program had a measurable success in statistical terms, which is wonderful to see. We just have some examples here of some of the main results. First, looking at improved gender attitudes. So we saw that agreement with inequitable household gender roles decreased significantly. Just a few examples. There was a 16% decrease in women agreeing that diapering, bathing, feeding children is the main responsibility of the mother. We had a 21% decrease in agreement that a woman's role is taking care of her home and family. And there was a 10% decrease in agreement that men have the final say on decisions within the household. And when we compared that to Marigold, to our comparison group, we found that the decreases in La Vallée were significant compared to the changes in Marigold, which were some changes happened, but they were less. Next slide. These were also reflected in reducing acceptance of violence among the community. So for example, compared to baseline, 40% fewer women in La Vallée agreed that it was right to keep the family together, even when they were living with a violent partner. So we really saw that sort of that acceptance of keeping the family together as the priority really reduced. And this again was significantly different than the comparison community in Marigold. If we look at the graph here, we can see that the percent of people who believed that violence was justified in at least one scenario had a marked decrease from 45% to 25% in La Vallée. In Marigold, interestingly, it was decreasing as well, actually even almost more significantly in the beginning. But as all of these contextual experiences in Haiti, COVID, increased insecurity, the economic crisis, as all of these things were increasing, it went back up in Marigold, but continued to decrease in La Vallée, again, suggesting the protective effect of the Rethinking Power program. And qualitative data also really echoed this idea that, community members would be judged harshly if they were known to be perpetrating violence, and a real sense that people needed to speak up and take action in their communities in order to make a change. Next slide. And then obviously our biggest outcome that we were looking at was the reduction in intimate partner violence. This was sort of how we framed the study and really what we were looking to see. And really excitingly, we found that rates of IPV in the intervention communities halved between baseline and endline. This is in the past 12 months, physical or sexual violence, and that reduced from 23% to 12% over the course of the program period. And really importantly, we saw decreases both in physical and sexual IPV, which is something that hasn't necessarily been seen in other studies with the SASA methodology. And also importantly, these were significantly different than any change that we saw in the Marigold communities. Next slide. Economic violence was another one that we saw some interesting trends. If we look at the graph, we can see that in La Vallée, the red bar, we see that it generally decreased from 17 to 11% over the course of the program period. In the comparison community, it was basically staying the same. And then, as I said, after midterm, when all of these contextual factors were really ramping up, it actually increased. So we can again see a real difference in trend between the intervention communities and the comparison. Next slide. So I'm going to stop here and I'm going to pass over to my colleague, Angela, who's going to talk a little bit more about some of the specifics.
Thank you, Maureen. So I'm really excited actually to talk about the reductions or the changes that have been enjoyed, I hope, by adolescent girls. One of the things that Emanuela discussed was that, we did not necessarily see the changes among women, violence against women trickling down to violence against girls in previous iterations. So with Power to Girls, we are actually seeing some very good numbers. First of all, let me just explain our ages briefly. When we are looking at the endline data, we wanted to capture the girls who were actually part of the Power to Girls. They were exposed to Power to Girls during the implementation. So we're looking at 15 to 23-year-olds that capture the 11-year-olds in the program at inception and the 19-year-olds that were also part of the program at inception, to see how they did after 4 years of exposure. And what we found is that we had almost a 40% decrease in intimate partner physical and or sexual violence that was perpetrated in the past 12 months, which is fantastic. 16% of girls at endline had experienced intimate partner violence in the past 12 months versus 26. So it went down at about the same rate as it did with adult women during the Rethinking Power implementation. The other thing that we were seeing that were really, really evident in the qualitative part of our program or our research is really profound improvements in voice and agency from the girls who participated. Not only did girls increase their ability to make decisions in their lives through the engagement of parents in Power to Girls, and have more freedom to choose how they spent their free time and who to be friends with. But we also see in qualitative data that girls are very confident as activists in their community and are very willing to engage male peers who may be perpetrating violence against girlfriends, or parents who are expecting girls to stay home while their brothers are out, having fun and doing activities. Many of the girls spoke about, approaching these young men or parents and discussing the rights of girls to actually be out in the community and to live without violence. One of the things that we didn't see was changes in their sense of safety. Girls majority feel very safe at home and at school and at church. What they don't feel safe doing is walking in their community or going to friends' houses. So between home and school, between home and church, going about their daily lives, we're not seeing safety there at baseline, or I'm sorry, at endline. And that's really to do with the insecurity. They discussed that at length in our qualitative, that because of the gangs in their community, they feared kidnapping and rape and other acts of violence against them. We also saw among the larger community much improved attitudes about girls and boys' roles, and the willingness to expect that both boys and girls contribute to the household equally. And we saw that again among the girls and boys and adults in qualitative, talking about how really girls and boys both go to school, you know, nearly 100%, and that both boys and girls are expected to help in the household. The other thing that I get to talk about is the differences in violence against women and girls with disabilities. And as Maureen discussed, we don't have data on women and girls with disabilities from our baseline in 2017. So we make the assumption that women and girls with disabilities have the same rate of 12 months physical and sexual violence from partners as women and girls without disabilities, even though we know that women and girls with disabilities very often have much higher rates of intimate partner violence. And so we see that the decrease, assuming the same starting point, is about the same as just among the general population, and a 35% decrease from 23% to 15%. Not quite as much, but moving definitely in the same direction. And most of this reduction did occur during the first phase of the project. So we know that, or we can infer that the community mobilization actually does decrease violence against women and girls, intimate partner violence against women and girls with disabilities, as well as those without disabilities. But despite the fact that we didn't see rapid changes between midline and endline when Safe and Capable was actually going on, we have a lot of qualitative data that says that that women and girls are more active in community roles and leadership roles, and are being sought out for inclusion in community affairs. We also see in our quantitative data that attitudes have vastly improved among the community about women and girls with disabilities, including their presence in their capabilities, assumptions about capabilities, and assumptions about having children and being married that were not present in the midline. We also see that we are having more equitable gender roles assumed within households. So presented with vignettes about couples in which the woman has a disability, focus groups discussed their expectation that the husband and wife would work together within the household based on the household needs and the woman's capabilities to get things done, and that they would actually work together to create an equitable and peaceful relationship and work through problems together. We also see that that women with disabilities have reported, pardon me, reported more support and help seeking behavior. What we also see from the qualitative is important because when speaking about the ability to engage and just for activities of daily living or in community mobilization activities, women and girls still with disabilities still had a harder time, and that was because of contextual factors. So women whose households are very food insecure were doing things to really improve their household finances and food security. Women with disabilities have to travel further for healthcare, and so increasing fuel prices or security measures that limit mobility between their community and Jacmel for healthcare was a problem for them. One thing that we also need to mention here is that women and girls with disabilities have had more of a role as activists and leaders in the community as part of the program, including 3 advocacy committees, one of which is girl-led and focused on improving access to public spaces for people with disabilities in the community. So we've come up with some key conclusions and recommendations, and many of these, are just from the on-the-ground day in, day out slog. Sustained commitment is needed for effective programming, and that includes long-term flexible core funding to women's rights and disability rights organizations. We could not have finished this implementation or the research without the generous flexibility of our funders. So many thanks again to those who supported us through the insecurity. Full engagement of women and girls with disabilities at all phases of design, programming, and research is essential to creating reductions in violence against women and girls with disabilities. We are not the experts, they are. More research is needed in low and middle income settings to really get a handle on what works to prevent non-partner sexual violence and dating violence. This is an ongoing problem, and we saw that again in this study, and really disaggregation of data by age, disability status, et cetera, is really needed. Seeking out, listening to, and collaborating with existing activist organizations and networks of women and girls with disabilities and others. Again, recognizing that the community, the people working in the community and living in the community and their lived experiences and work really makes them the experts, not necessarily us. And the final takeaway that I think all of us are really, really proud of, and really speaks to the dedication of not only the Beyond Borders, in-country staff working on the ground, but also the communities themselves, is that prevention of violence against women and girls is possible while leaving no one behind, even in incredibly challenging and uncertain conditions. And so with that, I will thank all of my colleagues, and we will open the floor to questions that are being fielded by Sarah Siebert.
Thank you, Maureen and Angela, for the presentation of these results. Very, I feel optimist after hearing all of these. I mean, again, my admiration to all of you for being working in this program with all the challenges. So we have very interesting questions already in the Q&A. Please feel free if you have more questions to just write them in the Q&A. But I want to start with one actually that was already answered by Sarah, but I want to go more in detail about the adaptation of the materials, because this is a very important area when we want to replicate these kind of programs, kind of like to go more in detail about the process of and also how you do the adaptation. Adaptation is not just to translate the materials, but how you adapt them. So if you can speak a little bit about that, and then I continue. I guess then I continue with the other questions. Go ahead, Sarah.
Great. And I don't know if Emanuela or Adonis want to say anything first. They were deeply a part of all of those processes.
Oh, okay.
Okay.
I don't know. We're trying to see that. Hold on.
Okay.
Sarah. Mhm.
All right, I'll start and they'll add in if there's anything. So yeah, and I think it connects with another question that was about time, method, financial investment needed for thoughtful adaptation. So just to say that the Power to Girls materials and safe and capable materials were actually created in Haitian Creole. So SASA Together was adapted in a really thoughtful phase by phase process. I mean, we really went in depth. So SASA and then now SASA Together have been adapted into Haitian Creole, but also with great effort at testing, working with Haitian artists, making sure that examples are relevant, making sure that timeframes, work in similar ways. There was a lot of attention to that. And the process around that was really careful. We involved the team who would be implementing. We had actually our community activists, because we adapted phase by phase as they knew more about what was needed. They were excellent testers of some of the next phases materials as well. We went into a lot of depth around, we changed colors, for example, because there was different cultural meaning. It takes time. Adaptation in a quality way really does take time. And then with Power to Girls and Safe and Capable, we were able to kind of co-create the Creole and the English. Actually, the Creole led, and the English was usually translated and catching up afterward in order to make it work. But then I'm glad that you bring this up, because we didn't get much to talk about the interest in Power to Girls or Safe and Capable in other places. We actually have an organization in Tanzania that has started using Power to Girls, which is Amani Girls Home, and an organization in Kenya, who I think is with us today, World University Services of Canada, that has begun to use Power to Girls in their in camps as well in Kenya. So just to say, it takes time. There is a lot of advice around that. I know Raising Voices for SASA Adaptations has advice around that. If you want to connect with them around that, they've done that in a lot of places as well. And for Power to Girls and Safe and Capable, we're also happy to connect a little bit more about what seems to work in adaptation, what some of the recommendations may be. One of the big things for us was to have a translation dictionary or glossary of terms to make sure that we're standard across lots of materials. And another main thing for us actually was a cultural consultant for the adaptation, for the first adaptation of SASA, in part someone who was very bicultural and could pick up on what people were not saying, which is usually the biggest problem in making sure that things are really resonating and relevant. What did you understand by that? It seems like the way you answered that question, what did you hear when you heard this word, that kind of checking up was done throughout. That all takes time, which also takes financial investment in the actual adaptation to create quality materials. So, thank you.
Thank you, Sarah. And related.
Can I just add one thing? Emela says the engagement of the community also was very important, because at the same time, when we finished adapting the materials and translating them, and with the cultural consultant, we did piloting in the community. We tested them with the community activists and the members of the community network, and that helped us to see how they understood things, how they understood the themes and the concepts that were being developed. For example, the concept of power in Haiti, it's very challenging. And so there were tests that were done at the community level with the communications materials, and the community could give us feedback on those materials. And that allowed us to go back in and to see how are they interpreting what we have in the materials, and particularly people in rural Haitian communities, because it's not the same in urban and rural areas. And so there was a back and forth and iterative process with the participation, quite interesting participation of community members through our piloting rounds. So we can say we mobilize several different kinds of resource people at the community level, at the national and international level, around the translation between English and Creole, and at the national and international level, and also for Safe and Capable, we had the support of an expert working in that field from the government institute working on that, and at the international level, people working on this theme of working with people with disabilities.
Thank you, Sarah, Emanuela, and Adonis. There are some questions kind of related to the adaptation, and also that comes to in the chat, related about the scalability and how you scale up something like this, and the costs. I mean, and that's also related to the financial investment, right? So how you really, in terms like in a context like Haiti, where also at the same time it's very challenging to work with the government for the conditions. Any idea of how you will scale up and the cost of scaling up this?
Maybe I can start with this one. Just to say that one of the things that it's important to remember is that impact is seen at the community level. And that's been something that's been interesting in conversations about, for example, the SASA methodology and scale. SASA, which, from Raising Voices, has been now adapted and has been used in over 30 countries around the world. But it's been done in like an iterative process of this organization hears about it, learns about it, wants to use it in their community, and it has scaled in that way. And that's not the definition of scale, for example, in which a government takes it on and it's now in 37 districts. That's not what it looks like. But it has reached so many communities and so many people because of that. The original SASA study, for example, was 260,000 people that impact was measured at. And if you think about scaling other methodologies that are not community level impact, you'd have to scale, for us, it was 46,000-ish people within the two communal sections in La Vallée. In order to use another methodology that just measures impact at participant level, you would have to scale that so many times to get to the 46,000 or 260,000, et cetera. So thinking about it in that way with cost is sometimes helpful for people. We did not do a cost analysis of this as far as I remember. I think we decided not to do that. But the SASA study did, and again, because of the community impact level of it, it is quite actually a low cost intervention per capita of benefit, if that makes sense. That doesn't mean it's a low cost automatically intervention. There is a bit of a ratio between how much staff you need and how big your community size will be. It's an intensive, it is definitely not a light touch methodology, because honestly, in this line of work, we have found that those light touch methodologies are not as effective. So I don't know if that helps to answer the question. I don't have the exact dollars and cents for our implementation, but there is a cost study connected with the SASA study that we'd be happy to share as well. It's a similar principle involved.
Thank you, Sarah. There are a other set of questions related to some types of violence that probably not necessarily saw reduction, or we didn't measure reduction. So it's a programmatic question and a research question. So one of the questions is about what can the program do to address this situation of safety, or the feeling safety in public spaces, or outside of the places that Angela mentioned, the home, school, and church. Any idea how the program could bring that? And then that's the programmatic question. And the research question related to that is also that was mentioned that more research is needed to prevent non-partner sexual violence or dating violence. What can you, the research team, can say about that? So we start actually with the programmatic, moving to the research.
Manuela Adonis, nous voulons parler un petit peu sur, I'm sorry, would you like, Manuela Adonis, would you like to speak at all to the first question and maybe the community mobilization process that we used? I think we talked a lot about the girls groups and the schoolwork in Power to Girls, but not as much about the community mobilization process that worked on girls' safety in more public spaces.
En fait,
Well, as you know, our methodologies, the three different methodologies we're working with, they are community mobilization processes that engage institutions and local authorities and leaders. And when we say authorities, we mean local authorities and institutions, including the police. They're working with them. We work with the police. We work with the local tribunals, courts. We work with the municipal authorities and other community or decentralized elected authorities. They are there, and part of their responsibility is guaranteeing security. So engaging them in the community mobilization process allows those who are duty bearers for public security to participate in the whole process of looking at how to prevent violence against women and girls, not only in a couple setting, not only IPV, but the fact that they become more aware overall through that norms change process, or that the community also needs to be a more safe space. And that involves people who are responsible for security, and they become more aware of the consequences of violence against women and girls living in their communities, and how violence affects communities more generally. So engaging them from the outset in the building of the community network is a key element that can help with that. But at the same time, we don't have any evidence around that specifically. We did not do research specifically on that point. We did training for them. We worked with them, and in the training, we have testimonies that came out where local authorities, including those in the police, they spoke of a violence, a reduction in violence, not only intimate partner violence, but violence in the community. Now, the gang problem that Adonis was talking about, there were several months of implementation. We were experiencing high levels of violence, but thanks to the community mobilization work around violence and around risk in a number of different scenarios that could be increased for communities. So these communities got together with the authorities and mobilized to engage with those who were engaged in violence and to push them out of the neighborhoods. And we don't have evidence. We just have anecdotal evidence, let's say, about the impact that it had. And we used our materials, community mobilization materials on the consequences of violence. And we could say that we believe that it contributed to those phenomena. Daniel, I don't know if you want to add anything. Okay, not.
Thank you. She's wondering if Sarah wants to add anything to that, or if there's anyone who wants to add anything.
Just to reiterate that the community mobilization process helps a lot with that, that once there are all of these networks of people in each neighborhood activated, talking, knowing they have each other's support to say something, it helps. I mean, it makes a difference. And there is really no kind of replacing that in the context of Haiti. Neighbors taking care of neighbors has a huge and beautiful positive cultural background, and activating that strength is one point of hope.
Thank you. And moving to the research part, Maureen, Angela.
Yeah. So I can maybe briefly talk about maybe some of the methodological issues, and I can pass it to Angela, and she might have a reflection or two on sort of what else is happening around non-partner sexual violence, not to put you on the spot. I will just say methodologically, it's harder to measure change around non-partner sexual violence because it happens less. And so like the way we do our sampling, it's easier to measure things that happen to more people, and intimate partner violence just happens to more people. It just does across the globe. So while there could have been some changes around non-partner sexual violence, our sample likely would have had to be much larger to detect it because we started off at a much lower baseline. And I will also say, of course, just the reality that there was a huge amount of increased insecurity in the community, as my colleagues have been talking about, obviously might have a more direct linkage with increases in community level violence. So it's really hard to tease that apart from like a researcher's angle in this evaluation, just because of the context. We can't say that we would find these same safety results if this exact project was implemented in another context where these additional contextual factors weren't happening. So I'll just flag that. And then Angela, if you have any thoughts.
Yeah, thanks, Maureen. I agree. I mean, it's so difficult in this group to measure because it's not very common. One of the things that we did find was that sexual harassment actually increased. And I think that being, the more minor type of non-partner sexual violence, not that it doesn't affect the people experiencing this, but it is not a physical assault. But that, I think, is interesting and probably very much based directly on the insecurity. From our qualitative, we know that women or girls especially were reporting, or not girls themselves. Girls Club administrators were reporting that their participants in the girls clubs were experiencing coercion by gang members to be their girlfriends, and really being harassed and coerced. And when we look at kind of the intersections of all of the insecurity, we're talking about girls who may have profound household food insecurity, or very low sense of safety in the community. And when they're being coerced by gang members who probably have more financial resources and can certainly guarantee their safety a little bit, you know, you have these kind of intersections where girls may be making, we may look at that as a form of violence, and it obviously is, but from their perspective, it may be self-protection. And I think we're seeing more of that in the insecurity. And otherwise, the girls tend to be protecting themselves, and their parents are protecting them by not allowing them to go to places that they've mapped out in the community that they feel the most at risk because of the presence of boys and gang members.
Thank you, Maureen and Angela. I have a question, very specific question also around research about how you measure intimate partner violence. And if you somehow verify your trend or the levels that you find with the records of the police or like administrative records. So just for two people
Thank
have
you
idea.
for that.
Yeah.
Just very quickly, so we use an ACT-based scale based on the conflict tactics scale, which is really meant to try to take some of the ambiguity around the term violence out of the picture. You know, it's very much, you know, based on acts that someone has experienced, whether or not they consider it violence. And this has, of course, been used in the WHO multi-country study on domestic violence. It's part of the DHS module now on domestic violence. So it's pretty much the gold standard, I would say, on self-reported violence measures. It is, of course, not perfect. We 100% know that all self-reported measures are not. So how we validated it was through a number of different ways. First, of course, through the qualitative data that we collected. Secondly, we also actually went back and had community meetings where we presented the results back to community leaders, to others in the community, to basically get their assent. Did this feel right? To understand that. We don't usually look at things like police records as a way, and you can look at it, but oftentimes it is so biased because it is so much the tip of the iceberg, particularly in a context like Haiti, where access to services is very challenging, where we really wouldn't necessarily have enough data to actually look at trends. But what I can say is, particularly for data, say at the baseline, you know, it was very much in line with the statistics that were found on national level around intimate partner violence, et cetera. So we were able to kind of look at it, sort of looking at other similar studies that have been done on the topic, at least at baseline, and felt pretty secure in our method.
Thank you, Maureen. We have 5 minutes left. I would like to move to the programmatic piece, but the very specific. There are a lot of questions, and people are very curious about Power to Girls. It's quite unique, new, innovative. So if you can talk more about the learning materials, the tools you use, and if potentially you can adapt that to a shorter version if you have like less time. There's another question about what happens if there are some groups that go more advanced than others. So all of that about Power to Girls, if you, Emanuela, Donnie, Sarah, you can talk about it. Thanks.
Well,
Quickly, I'll start with the last it's not recommended to try to squeeze it into a shorter time period. It is a process, and the process takes time. You have to go, it's a phased process. So you really need to do that in order to change norms. I would say also, however, what was interesting in Power to Girls is the materials that allowed us to do activities with the community and with girls. There were materials like little comics around Jessica that were talking about girls' experiences in young girls in the community. You have little chats with parents that are specifically made for parents at the community level around girls' power and violence against girls. You have also posters like in SASA, which engage people in reflection around violence against girls and power of girls. And the girls also, at the same time, through the clubs, they're engaged in their own change process, which also contributes to changing the community level. What's interesting is that the Power to Girls toolkit it also engages boys and girls and everyone in being actors of change of social norms in the community through the activities. So, and the other thing is that within Power to Girls, someone else in the room is giving them a little idea here. I wanted to add, Power to Girls is a methodology working on beliefs, knowledge, and behaviors. So behavior, attitudes, and knowledge, attitude, and behaviors at a social level, and how you change those norms. So you can't, there's no shortcuts to that. You really, to get change, you gotta go through that process and follow the methodology to achieve the impact. And I think also Power to Girls was developed on the basis of the SASA methodology, but you can adapt it in your context, in your implementation, how you take into account your context. You can, in Tanzania, for example, they are working on developing that, and in Kenya also. So they're looking at how they can adapt Power to Girls to their context. And I think that within Power to Girls, it is one of the challenges that we had was to engage girls in the 15 to 19-year-olds in the clubs instead of the 10 to 14-year-olds. So the girls in the clubs, to get them, not all groups will advance at the same rate, but at the same time, the method is there to accompany them at their rate, whatever their rate is, to walk with them and accompany them from where they are, to support them in where they want to go in their changes. And in the communities, it's the same. Not everyone evolves at the same rate. So that's why there are different spaces going on for different community members, and a specific space for girls to engage. Specifically, there's work, for example, also done in churches around Power to Girls. There's work done with parents in the community. There's specific work done with teachers at schools who are involved in education and socialization of, and that can bring in discriminatory values or other kinds of values to within the educational process, and to help them support a balanced power between boys and girls, and institutionalize it in the community at all these levels. I could say more, but that would take all day. I just, yeah, and Sarah might have things she'd like to add to that.
Just really briefly to reiterate Emanuela's point that people always want to abridge long methodologies, and they're like, but we're really savvy, we can do it faster. But the community doesn't move that fast. So because it's a community-wide methodology, you're listening and figuring out where they're at, like Emanuela was saying, and it's important to continue that process at the pace that they are going, not at the pace that you wish they would go. And we know that 3 years of funding, 4 years of funding, SASA, they say 3 to 5 years, and same with Power to Girls, depending on, you know, can go up with adaptation time, with contextual challenges, etc. We know it's hard to secure that funding, and that's why long-term flexible core funding for this type of programming to be effective is so critical. But just to say that it has been tried. I mean, people tried with SASA a million different ways to make it shorter, and it just has not worked at a community level. If you want to do a shorter methodology, there are other methodologies out there that work at participant level and that have shown change.
Great. Well, thank you. We are coming to the end of our event, and this has been fantastic. There are other questions, so please feel free to contact the participants, and I also have so many questions to ask, but I leave it for the next time. And it's been a pleasure. Thank you, all of you. Thank you for this great work, for your commitment, passion, and rigorosity to implement and research this that is so important for the life of women and girls. And thanks to the audience for staying here with us and decide to spend this hour and a half with us. I think it's been great, worth it, I'm sure. And see you next time. Bye-bye.